Hi students, so this week I want to talk a little bit about private insurance, okay? There's so many different types of insurances out there that consist of private insurances. Some examples are Blue Cross Blue Shield and Aetna. Both of those are really popular private insurance companies that many employers are facilitated with, okay? I want to talk a little bit about some advantages and disadvantages of private insurances since we have some assignments dealing with insurances this week. Okay, so some advantages of private insurance is number one, you say that you're going to the hospital to get a surgery done or you're having a baby or something like that. Your opportunity to get a private room just for yourself, and if you want a family member to attend with you, is a lot better chance of you getting that than someone who has Medicare or Medicaid. So it definitely has advantage as far as getting more options and more opportunities for better rooms and better things like that. Some other ones is you get usually the best doctors are available to private insurance companies. A lot of them cover most of the care with private insurance, so you have good options as far as physicians to pick from. You usually don't have to deal with any types of learning or teaching facilities to go to. A lot of hospitals are teaching facilities, and usually patients who have private insurances have the option to go to hospitals that don't have any type of student or educational work going on in that facility. So it's nice to know that you are getting your care from an actual physician rather than someone that is practicing to be one in the future, right? So that's an advantage. Another thing is their their flexibility with specialists for specific illnesses and conditions. So usually you have a good option, excuse me, of specialists that you can get if you want for specific illnesses. If you have a heart condition, you have a wide variety of cardiologists and things like that to pick from. So that's really nice that you have that flexibility. As far as on the downside and some disadvantages of private insurances, one thing is not all conditions are covered. So sometimes you run into issues with that. Another thing is you get what you pay for. So if you do have lots of options, but sometimes the options are more expensive options. So if you pick one that isn't as expensive that your insurance will mostly cover, then sometimes the care might not be as good as it would be if you got something that was better quality and more expensive. Another thing is time constraints with consultants. So with private insurance companies, you have lots of different, sometimes consultants to deal with, and they're very, very busy. They're dealing with lots of different patients. So sometimes you come into time constraints on getting things organized as far as appointments, getting surgery scheduled, and things like that. Sometimes you've got a tight schedule to work with. Sometimes they put you off a little bit if they're able to. Patients don't seem to like that very well, and I don't blame them. No one wants to wait to get care done, right? Another disadvantage is premiums are constantly rising with private insurances, and you're responsible to make sure and pay those premiums, pay your copays and things like that. And it seems like each and every year they're adding more and more money to that premium. And that's, very difficult sometimes for people to afford. So I just want to talk a little bit about private insurances and, the wonderful things about it and the things that aren't so wonderful about it. And we'll also be talking more about Medicare and Medicaid this week and the advantages and disadvantages of it as well. Okay, so if you have any questions, feel free to contact me. Have a great week. Thanks.